You know, we all have that go-to spot. That local pharmacy we trust for advice, for medicine, maybe just for a little peace of mind. It's kind of the bedrock of community healthcare, right? A place built on trust. But what happens when that trust is on shaky ground? Today we're diving into Nepal's incredible quest to make sure every single pharmacy meets a global standard of care.
So let me ask you something. Think about your local pharmacy for a second. When you walk in, do you feel like you're meeting with a healthcare professional? Or is it more like you're just buying something from a seller? That difference, that tiny distinction, is actually at the very heart of what we're talking about today, and it has huge implications for public health.
Okay, so let's get into the nitty-gritty. The gold standard we're talking about is called Good Pharmacy Practice, or GPP for short. It's an international framework that was set up way back in 1992, and the whole point is to define what a pharmacy should be. It's not just about moving products off a shelf. It's about making sure patients are safe, the medicines are high quality, and that we're all using drugs rationally. Basically, it's what turns a simple shop into a critical healthcare service.
And to give you a sense of the scale of this in Nepal, get a load of this number. We are talking about over 28,000 registered community pharmacies. That's almost 29,000. This is not some small niche issue. Every single one of those is a healthcare touchpoint for millions of people. So you can imagine, getting GPP right is a massive undertaking, but it is absolutely essential for the country's entire healthcare system.
And you know, this whole thing didn't just pop up yesterday. Nepal has been building the groundwork for this for decades. I mean, the legal foundation was laid all the way back in 1978. The official GPP guidelines were published in 2005, and there have even been big nationwide training programs happening recently. So the rules are there. They're on the books.
So you'd think things would be on the right track, right? Well, here's the kicker. There is a huge gap between what the official standards say and what's actually happening on the ground. Despite all those laws and training programs, compliance is just not great. It's inconsistent, and that creates a really serious problem.
And when I say a huge gap, I mean it is like night and day. On one side, you have the GPP ideal. Pharmacies run by qualified pharmacists, focusing on patient counseling, safety, the whole shebang. But then there's the reality. All too often, you find these places are run by people who aren't even authorized, where the focus is on profit, not patients. And that leads to a very real risk of things like counterfeit drugs. This isn't just about bad customer service. This is a direct threat to people's health.
Which, of course, brings us to the million-dollar question. If the rules exist, why aren't they being followed? What's going on here? Well, the research points to four main reasons, four core challenges that are really holding things back. So let's break them down one by one.
All right, first up, let's talk about professional barriers. A lot of pharmacy staff just aren't fully aware of the GPP guidelines, or they have this misconception that these rules are only for the big, fancy hospital pharmacies, not their little community shop. Now, you mix that with low pay, a super heavy workload, and pretty much zero incentives, and you've got a recipe for serious demotivation. It's really hard to provide top-notch counseling when you're just trying to get through the day.
Now, on top of that, you have the second challenge, structural barriers. We're talking about the physical buildings themselves. A lot of these pharmacies are just not set up for success. They're cramped, poorly designed, and super overcrowded. And that's not just about looks. A chaotic environment makes medication errors so much more likely. Plus, they often lack modern tools and any kind of internal system to double-check their own work.
The third challenge is a big one, and it's all about culture. Let's be honest, we've all done it. We're in a hurry, and we just want to get our medicine and get out. That demand for fast service really discourages pharmacists from taking the time for proper counseling. And it all feeds into this wider public perception that pharmacists aren't really healthcare providers. They're just people who sell medicine.
And this quote just hits the nail on the head. That term, Oshadi Pasale, it literally translates to medicine seller. When that's how the public sees you as just a shopkeeper, it completely undermines your professional role. It makes it almost impossible to deliver the kind of care that GPP demands. It's a massive cultural hurdle to overcome.
And finally, we've got the fourth big challenge, regulatory barriers. So you have these official bodies, the DDA and NPC, who are supposed to enforce all these rules. But the truth is, they're severely under-resourced. They don't have the money or the manpower to do regular inspections, to follow up when someone breaks the rules, or even to make sure everyone has a copy of the guidelines in the first place. So the rules exist, but there's nobody to enforce them.
Okay, so I know that sounds pretty tough. We've got professional, structural, cultural, and regulatory barriers. But here's the good news. It is not a lost cause. Not by a long shot.
The research actually lays out a super clear and actionable plan for how to fix this, a real blueprint for change.
And here it is, a 4-step strategy. It's a holistic approach. First, you build capacity. Make ongoing training mandatory for everyone. Second, you strengthen enforcement. Give those regulatory bodies the teeth and the resources they actually need to do their jobs. Third, you educate the public. Launch campaigns to shift that perception from medicine seller to healthcare expert. And fourth, you incentivize the good guys. Create rewards for pharmacies that actually follow the rules. See, it tackles every single one of the challenges we talked about. And if they can pull this off, the payoff is just huge. We're talking about fewer medication errors, which means better health outcomes and lower healthcare costs for everybody. It would rebuild public trust and totally elevate the pharmacy profession. And of course, it would bring Nepal's pharmacy services right in line with the best in the world. It's a win-win-win.
And what's really interesting is that Nepal is not alone in this struggle. You look at countries like Thailand and Lebanon, and they're facing really similar challenges. But the key lesson here comes from South Korea. They've had a lot of success implementing GGP. And what was their secret? What made the difference? It all came down to one thing: strong, unwavering institutional support.
And that, right there, is the single most important takeaway from all of this. You can have the most dedicated, passionate, motivated pharmacist in the world. But if the system around them isn't set up to support them, if the government and the regulatory bodies aren't all in, it's an impossible uphill battle. Change has to come from the top down.
Look, the path forward is clear. It's not going to be easy, and it's going to require real commitment and coordination from everyone involved, from the government right down to the general public. But with that kind of focused effort, Nepal has a very real chance to completely transform its pharmacy practice and make a huge improvement in public health for every single citizen.
So, this brings us full circle, right back to that first question we asked. But maybe now we see it in a new light. What is the true value of a pharmacist? They are so much more than just sellers of medicine. They are one of the most accessible and trusted parts of our entire healthcare system. And making sure they have the support they need to live up to that potential, well, that's something that benefits us all.